connection between oral health and other aspects of our health is a clear one in many aspects. One is that it's been shown that a patient who has problems with their mouth, that quite often the bacteria involved can stir up trouble in the rest of the body, various systemic diseases. But even as much or more than that is that patient who, because of poor oral health, because of chronic pain, they have a low self-esteem, they find it difficult to smile in public, and that's something that's less measurable but can have a huge impact on the way a person functions in their work and in society.
Being a hygienist for 30 years, what I've noticed is a lot of times myself or the students, we pick up on other systemic illnesses by just looking in the oral cavity. So as hygienists, we are that first stopping point that we could make a difference.
We have a lot of stories of children who were enrolled in our program at a later age. So they may have been 2 or 3 years old when they came to us, and of course, severe decay. You really see how it affects not only their physical health, they're not able to eat, so they don't have proper nutrition, but it also affects their physical health, and they're in a lot of pain. So sometimes that can make them have behavior issues because they're acting out. And I do have one little guy that we were able to connect to the dentist. He had 9 teeth removed. And just to go back and see him, it was really just a changed child. He felt better. He could eat more foods that he wanted to eat, and Mom understood the importance of making sure that good dental health continued because he also had a younger sibling.
Dental caries is the most common chronic childhood illness in America. It's even greater than asthma, and I think almost all of us can relate to knowing someone that has asthma. Sometimes just getting basic routine care by age 1, which is what the American Academy of Pediatric Dentistry recommends, that every child should have a dental home by age 1. And if we start that early on with a pediatric visit, routine care, we can often prevent dental disease. So prevention's key.
I think that Williamsburg could be an exemplar for the state, if not the nation. This is a really collaborative group. When I think of some of the safety net sites here, they're exemplars in integration, in making sure that people that are being seen on the medical side are also being seen on the dental side. When I look at the home visiting and organizations like CDR and the way they've integrated oral health into all aspects of the touches that they have with families is really remarkable and exemplar.
Our dental clinic is connected to our medical clinic through an open hallway, not even a door. I mean, we can walk across the hall and ask each other questions, or I could have her come look at a patient and vice versa. And that's a wonderful collaboration that we have. And the truth of the matter is, because I have dentistry right next door to me, it makes me more mindful of my patient's teeth. I mean, I look in everybody's mouth now and just get a basic sense about where they are from an oral health standpoint.
When moms are expecting a baby, while we make sure they're connected to an OB, we make sure that they're connected to a dentist. It does carry through to their children. It's a continuation of the importance of dental care from pregnancy throughout childhood, and we're hopefully into that child's adulthood. And so it's each generation knowing the importance of it.
The community in Williamsburg has really a proud history of people in the community just seeing a need and coming together to fill it. So that's really the genesis of CDR, was parents whose children were not allowed to go to public school because they were deemed not school ready due to their disability. So the parents got together and formed their own school. Old Town Medical Center, their history is very similar in that there was a need identified. The community decided that this was a great idea to get together and form that wonderful organization. So I think the Historic Triangle, the Williamsburg community, has a great experience doing things that just need to be done and not worrying about waiting on the state or the government to fix things. People just come together and make it work.
The community of Williamsburg is actually fairly lucky. We have a very active community of dentists. This community is also huge on giving back. There's a number of outreach programs for both kids and adults. Ours is just one more layer. I would hate for anyone to think that we're the only charitable dentist out there. We're really not. We're one more layer in this community.
I think often people blame a lack of education or a lack of caring about oral health for why folks aren't accessing services. In my experience, most of the folks that I talk to are very aware that oral health is important. They're very aware that when their mouth is not healthy, they are not healthy. But they're dealing with accessing a system that doesn't work for them.
But this is a very interesting and problematic time for both oral healthcare and medical healthcare in the United States. We have a dysfunctional system of paying for healthcare, and until it is solved, there are going to be inequities in healthcare that's available, both oral healthcare and medical healthcare.
When you look at the healthcare system itself, dentistry is not a part of the Affordable Care Act, if I might say. If you're a veteran, you get medical, you don't get dental. If you're over 18 and you have a problem, you don't get dental. And when you look at our elderly, they don't receive dental care at all. Medicare will take care of medical, but it won't take care of dental. So it's almost like dentistry is a separate package, but it's not.
From a macro perspective, it is very difficult for adults to access dental services without coverage for dental services. Without a reimbursement source, it is very difficult for dentists to provide the care for the large number of folks that are in need. And while it might seem like a simple solution to provide coverage, even that's complex. It involves policy change, it involves a lot of decisions that are happening far and away above where the care is being provided.
We try to focus locally, but there can be great benefits when the state policies and regulations align with what's going on and needed on the ground. Prevention always saves money in the long run. It can be a challenge to convince elected officials to put money into prevention when there's fires to be put out in a state that has a fixed budget. So for us, we constantly try to advocate for prevention because it does really have great savings throughout the whole system. We learned that at CDR.
The Virginia Oral Health Coalition, I am grateful for Sarah Holland and her crew because they can advocate. We're often, very busy in our practices with patients, but having someone out there spreading the word and making sure that even our politicians know how critical it is to not only have medical insurance, but have dental insurance. It's worth its weight in gold.
The folks in Williamsburg really recognize that while charity care is not the solution, we don't have a system right now where everyone is able to access care. And I think that the folks in Williamsburg and the surrounding area do a great job of caring for their own, and that making sure that while they are advocating for broader change so that there's coverage for everyone who needs it, so that the barriers are broken down so it's easier for folks to get them, that by offering some of the volunteer charity care programs that they do, offering dental care on a sliding scale, they are working to make things accessible for everyone while we're waiting for a bigger and broader change.